Good morning and welcome those of you here in Denver, Colorado at the Office of Compassion and Choices and those of you dialing in from around the country. Compassion and Choices is the nation's largest and oldest nonprofit organization advocating for better end-of-life care and choice. And today we are announcing the start of a public education campaign for this entire nation called Peace at Life's End Anywhere. This is a campaign to protect end-of-life rights and to inform Americans that they have these rights and what steps they can take to effectively exercise them. This campaign is based upon the experience of Neil Rudolph's parents, Armond and Dorothy Rudolph, and they were evicted from their assisted living facility when they informed the management that they were going to exercise this legal end-of-life choice to stop eating and drinking. Our first speaker will be Neil Rudolph.
Thank you and good morning. My name is Neil Rudolph. I live in Alamosa, Colorado. My parents, Armond and Dorothy, died in January. They had lived a great life, married for 69 years, raised a family. They were very active leaders in their church and community in Albuquerque, New Mexico. As they approached their 90s, Mom and Dad were unable to maintain independent living in their home. In the spring of 2008, they moved into a retirement facility in Albuquerque. In October of 2010, following serious medical conditions, my parents moved into the village at Alameda, also an assisted living facility in Albuquerque. They were both over 90 when they moved. Soon the quality of their lives started to deteriorate more rapidly. My dad's spinal stenosis was causing severe pain episodes, and Mom was close to total immobility. Both had the onset of dementia. They decided to control their deaths and die peacefully at home, as their options were beginning to dwindle. In our country, you have the right to choose a peaceful death, but most don't even know they have that right, nor how to ensure it can be exercised. They both knew they didn't want to endure a lingering decline. Neither of them wanted to lose their independence or die in a hospital or be kept alive by tubes and machines. Several years previously, they had shared their views with my sister and me and completed all of their end-of-life documents. These included advance directives and living wills. At Dad's request, we called Compassion and Choices end-of-life consultation service and spoke with a counselor there. My parents decided to voluntarily stop eating and drinking, also known as VSED. This is a choice respected by law and medicine throughout our nation. My sister and I fully supported their decision. This process allowed time for Armond and Dorothy to phone loved ones and share memories and say their goodbyes. In January 3rd of 2011, Armond and Dorothy signed written statements confirming this decision after they had actually started the fast the previous evening. A day later, we shared this intention to use VSED with the staff at the assisted living facility, and at the request of the village, enrolled Armond and Dorothy with hospice, a day or so earlier than we had originally intended. This is when others' ignorance and of my parents' rights begin to disrupt their carefully considered end-of-life decision. Sadly, instead of supporting their valid choice, the assisted living facility called their headquarters and were instructed by the legal department to inform my parents that they were to vacate the very next day. The next day, I thought we had an agreement to be given a 30-day notice. However, the legal department directed the staff to call 911 for suicide intervention and to remove my parents for psychiatric evaluation. A full fire and police department emergency response followed. But the responders determined that my parents were acting rationally, and the EMT physician determined that Armond and Dorothy should be allowed to remain in their house. Rather than face further harassment, we made the decision to move my parents, who at this point needed our full attention. The move was very hard on them, but there, surrounded by their family, they were able to carry out their wishes and cross the threshold to a peaceful and dignified end. My parents fasted until their deaths, Dad dying the morning of January 13th, and my mom on the evening of January 14th, 2011. This is the happy ending to my parents' end-of-life story. They did find the dignified, peaceful death they both sought. But it's a cautionary tale as well. Anyone living in assisted living facilities should be especially aware. Applicants to assisted living facilities must review the facility's offered contract carefully and negotiate clarity on any points regarding end-of-life decisions they may consider. I'm working with Compassion and Choices to increase awareness of end-of-life rights, especially VSED, and to make it respected and honored across the country. I hope my parents' experience can be the platform that improves end-of-life choices for others with increased understanding and avoidance of pitfalls. That's exactly how Armond and Dorothy would have wanted it. Thank you.
Thank you very much, Neil. And on behalf of Compassion and Choices, we want to thank Neil and the Rudolph family for sharing the story and for working with us here at Compassion and Choices to inform Americans across this country of their end-of-life rights. It is our job to offer no-cost information and support to all U.S. residents regarding end-of-life care and choices, and to be a resource for patients, families, and healthcare providers on all end-of-life options, including VSED. Our national president, Barbara Coombsley, will now talk about the public education campaign that we are embarking upon to make sure that what happened to Armond and Dorothy does not happen to others.
Thank you, Steve, and thank you, Neil, and thank you to everyone who's joining us. At Compassion and Choices, our mission is to improve care and expand choice at the end of life. And we do that in many ways that utilize education techniques, public education techniques. We're in courtrooms and state houses across the country, always looking for opportunities to bring people the option to find a peaceful and a dignified way to end their lives. This campaign started when kind of two light bulbs went off. There's nothing new about it being legal, legal and medically acceptable for people to stop eating and drinking. But it is not generally known, and it is not universally available. But one light bulb that went off was when researchers in Oregon discovered last year that although Oregon, of course, is a state where aid in dying is legal, where people who are terminally ill can legally obtain a medically prescribed medication that they can take, they can self-administer and bring about a peaceful death. Yet even though aid in dying has been available in Oregon for 14 years, twice as many Oregon residents dying in hospice choose to die by voluntarily stopping eating and drinking than those who choose to avail themselves of the state's Death with Dignity Act. And this struck us as surprising. And it started us thinking about how this option is generally available, it is attractive, it is peaceful, it is painless, yet people throughout the country don't avail themselves of it. They may turn to violent means, they may suffer needlessly, just because they don't understand that this is an option that is legal and safe and available in every state. Then the second light bulb went off when we heard the story of Dorothy and Armond Rudolph. And we realized that even with careful planning and resolve, people who do understand their right and do take steps to exercise their right may have obstacles erected in their path. And so we realized that we have an important role to play. We have an important role to play in educating people throughout the country that this is their legal right, and also in protecting people who would avail themselves and protecting physicians and medical providers who may be uncertain or who may wonder about whether they might face professional discipline. So today we launch a campaign. We're going on the road in myriad ways: internet, community forums, press, obviously, and we're also making a commitment. To anyone in the United States who makes a well-considered, reasoned decision to stop eating and drinking and find a peaceful end of life in that way, and they encounter obstacles, our advocacy and our legal team will come to their assistance and help them overcome those obstacles. To any healthcare provider, any hospice, any nurse, any physician, any social worker who feels that they may be endangering themselves or coming under professional or legal scrutiny for providing palliative care and emotional support to someone who is stopping eating and drinking, we will help defend you. We will help ensure that you come under no harm for offering that medical support to a person who is exercising their legal right. We will do this through our advocacy and our legal programs. We will do this at no charge to anyone. We will do this because it is our mission. It is our mission to provide any educational information, any materials, any legal assistance in order to prevent unnecessary and unwanted suffering and allow people to find a death that comports with their values and their beliefs.